Dr. Bessler.
Well, on the question of does socialized health care ration and deny care, socialized health care not only rations its services, it denies them outright for citizens deemed unworthy by the government. For example, in Portugal, I found, to my amazement, that physicians in the National Health Scheme are required to see, not really care for, but to see 45 patients an hour. I bet you were thinking a day. 45 patients an hour. Professor in the University of Lisbon told me this personally. She said, I pay to the national scheme, but I also pay a private physician, so at least I can sit down and talk to him about the findings in what the medicine is supposed to do. 45 patients in an hour, hardly enough time to say, hello, how are you? If you have noticed, sometimes your physicians here are pressed for seeing more and more patients because the payments are lower and lower. It gets kind of tight to maybe 5 minutes a patient. Don't push them any further or you'll get, hello, how are you? I might mention here, we were in Australia and met a lady who was so happy to be up and around. For the first time, she was visiting relatives. And I asked her what the problem was. She said she needed a hip replacement. I said, how long ago? Oh, it was diagnosed 2 years ago. But they put her on the list, and it took 2 years for her to get to the head of the list for the surgery. By that time, her other hip went out, and she became not just on a crutch, but in a wheelchair for 18 months. And she was so pleased that she got both hips done, and it didn't cost me anything. I had to bite my tongue not to tell her, if you were in the United States, you could very well now be a multimillionaire because you could sue your doctor for malpractice. 2 years to do a hip when sitting in a wheelchair creates more and more complications by bone deterioration. That's Australia, and that's even better than Britain.
Dr. Thompson.
In terms of combining, whether government payer with no competition, along with socialism or socialist medicine, rationing and denying care, the obvious answer is certainly yes. You're forced to. There's no way around rationing care in any number of forms. But one of the things that I think should be looked at when we start talking about reform is the various policy options that are being put forth. Does it put our current system in jeopardy in moving towards a single payer? We've all are very much aware that President Obama has even indicated that if he could start all over and develop a healthcare system from scratch, it would be a single payer system. It would be various form of socialized medicine. Well, that certainly should beg any question with any kind of reform that puts our system in jeopardy of moving towards that single payer option. And a lot of things that have been brought up and have been mentioned regarding the different reform options do put pressures in moving in that direction. And so you are then faced with less choices. You're forced with somebody else making those choices. They're going to be forced to ration care and ultimately denying care. And so that's a choice that has to be made, and hopefully you make the choices of what's important to you.
Dr. Scioli.
Well, let me first acknowledge the argument that by having a public option, a government-run, government-mandated insurance plan that would compete with private insurers, would act to help insurance companies be honest. Let's acknowledge that argument. Well, David Goldhill, who in this month's Atlantic magazine And he wrote an article that's right down the middle. It's not a left-leaning article. It's not a right-leaning article. He states he's a Democrat in the article. But he wrote an absolutely fabulous expose that followed him watching his father die in a hospital in this country. He died of sepsis. And the ugly truth came to him, and he had to admit that all government efforts to control costs have failed because government worries about price, not cost. I mentioned this earlier. The ugly truth came to him, price, not cost. In our government's effort to expand access to care while limiting costs by capping physician reimbursements, hospital reimbursements, that's how you keep it down. You push them down. You tell your kid, be quiet. Here. It's like blowing up a balloon and squeezing it at the same time. How much sense does that make to anybody in this room? None. None. So the legitimate question is, truly, how would a government plan that would pay us Medicare rates, Medicare on steroids, let's give them their break, their term, Medicare on steroids. I can assure you, I already see 50% Medicare in my practice. My mother's on Medicare. I ought to make it a rule, no Medicare unless you know my mother. All right? So I can make a living. All right? I'm being facetious, but I'm also being truthful. Hospitals and physicians on Medicare rates alone would not be able to keep their doors open. This is not being a pig at the trough. This is shutting down the gas station on the corner. That's what it means. Now, if your government plan doesn't have to pay taxes, makes its own rules, and then it forces an insurance carrier on that uneven playing field, then ultimately the slow burn, as Dr. Thompson said, the slow burn would be that we would lose our option for private care. It's a possibility. Let's just say it's a possibility. It's not an absolute. What if we had a blended system like France? Many people who, and I'm sure many of you, don't know what their blended system is. I can't explain it to you this quickly, but let me suggest something to you. In our country, we're not France. We're America. Business is run a different way. This is a global economy, but this is an American problem right now. So understand that if our private insurance carriers are slowly burned away, then you have a single payer. Now, what does that mean? There's what's called unintended consequences. Understand what that means. The government, to administer their plan, as Dr. Buesler said, and as you heard about what they do in England, they have to have a set of parameters by which you practice by. Now, that's just the way it would have to be. I would be told who gets the HIP. Now, that doesn't mean you won't get one. It would mean how you would get one. That's un-American. Nobody in this room would tolerate the rules of engagement that her mother experienced. Nobody. So stop it. Just understand that. We know this. Now, if that's the case, then we need to be more responsible about how we act, know our costs, have our government know what the costs are, and allow the private sector to do what it does best. The government is good at making rules that we need to play by. But like Jerry Jones, stay in your box, buddy. Don't go down on the field. All right? And just get out of the way. You're the big cheese. You own the billion-dollar deal. You don't need to be on the field screwing it up. It's that simple.
Thank you.